So we've asked Jim for personal reflections on having sat through these 2 days, but also to the extent that he can to talk about what would be helpful moving forward and some expectations of what this work could mean in terms of the utility to USAID.
Thank you, Sheila. This meeting takes place not in the infancy of quality improvement for lower and middle-income countries, but I would say more at the adolescence stage. This is a field that has been in existence on a fairly large scale for maybe 10 or 15 years, and we have, in that period, have accumulated substantial experience. And this discussion in the past 2 days has focused on the evidence. What do we know? What's the basis that we have established from that experience for learning and improving going forward? And I think that it is clear from these discussions that we have a lot left to learn, but I think that the discussions have highlighted a large number of very important issues. I would also like to make some mention of topics that were not discussed, because I think when a group like this doesn't discuss a topic, that too is worthy of note. If I were to try to summarize the kinds of evidence that are of interest, it seems to me that we have been talking primarily about outcomes or the results of quality improvement programs. That's the evidence that most of the discussion has revolved around. There's a related set of information or evidence that describes how those results were achieved. And a number of our speakers have described at some level of detail how some of those data were achieved. And I think that in itself, although it was not the dominant theme of the meeting, that's important to bear in mind, that for others to learn from the experiences that we've accumulated, they don't learn from just looking at a data set. They really need to understand what was done and what they might need to change or actually copy very closely. So the discussions of evidence for the past 2 days then, I think, focused on what I'll call the more high quality evidence. It's not as high as you would like. We've certainly heard that assessment more than once. But it's focused, I think, primarily on evaluations of QI programs. And one of the issues that has come up repeatedly is that we don't really have a good model for these evaluations, that they are variable, but it's still a new field. Research in this field is another source of high quality information. I think we're probably in agreement with the implication that there's not nearly enough of this that has been done. I would like to think that we will see some research that addresses specifically how quality improvement programs in these countries work and can be improved. To give you a concrete example of that, in an African country in East Africa, a large-scale quality improvement program was being introduced, and one of the issues in that program was how to structure the coaching for the teams that were going to be developed. And there were two options that the planners came up with. One was, well, let's have the supervision and coaching done from our office here in the capital, because we have enough people to do that, and they're very highly trained and highly intelligent. The second model they had in mind was, let's ask the provincial offices to take care of the coaching responsibilities. They are closer, they probably know the lay of the land better, and they're probably not as costly. So both of those seem to be viable options. But when they looked at an actual side-by-side comparison through a field test, they saw that the impact of the more intelligent people from the central city was the same as for the provincial teams, but the provincial teams cost 1/5 of what the central teams did. So it's just a concrete example of the variations in design of quality improvement programs. There are probably dozens, if not hundreds of them, none of which have been examined the way we examine healthcare itself. So examining the alternative designs of quality improvement programs, I think, is one of the areas in research that we haven't talked about, and that may very well merit some additional discussion. In summarizing the state of the art from this program in this field, one of the missing areas for me was the discussion of program knowledge, or what we've learned from implementing programs. And I think that it's important for this body to recognize that many quality improvement programs have collected an extremely large amount of objective measurement data. There is it's not a total lack of data. Many of the programs that were present here did not talk in detail about the volume of data that they have, but I think it would be a mistake to convey the idea or the impression that this field doesn't understand what's going on or the effectiveness of the interventions that you've supported. There are lots of data that deserve to be recognized and improved upon with research and evaluation. I think there are also some areas where there have been implementation of activities with no data collected on impact at all. And I think of training as probably the biggest offender there. So there is room, I think, for giving credit to quality improvement efforts that have done that job, and even though we recognize that more data is needed. So that would be data that comes from routine monitoring and reporting, in addition to the research and evaluation. The topics in quality that have been addressed by the evidence that we've discussed in this meeting have been largely focused on effectiveness. So we've talked a lot about what we have established and what we have measured in terms of the effectiveness of different approaches, the complexity of doing this when it's dependent on context. We have a much, much smaller evidence base on the cost effectiveness of those programs. We should be grateful that we have that much, but I think we have even less of an evidence base for some of the challenges for long-term sustainability, for what are the factors in institutionalizing quality improvement as a permanent part of healthcare. We know much less about non-clinical processes like human resource management, how to improve that. And scalability is a term that we've used and referred to a lot, but we have an evidence base in that area that I think is still quite small. So those are gaps where I think we need more evidence to discuss in future meetings like this. I thought it was significant that several of the speakers mentioned the fact that donors have been reluctant to support research and evaluation in this field, and I think that's an important lesson to bring out, or an important point to bring out in the report from this meeting. I hope that it will be influential. We've also, I was impressed that the topic of the role of external advisors was recognized, but I don't think that it was dealt with in detail. The future sustainability of any quality improvement activity that is dependent on external advisors is not very bright, and we will not be able to deal with that issue until we are able to separate the role of the external advisors and those of their health system counterparts. Those cannot be mixed together in a single analysis. So I think this has been really a benchmark meeting to discuss these topics. I think has been an enormous benefit to the field, and I think this will be a very influential meeting. My plans would be to take the report from this meeting and perhaps recruit some of the participants for some kind of separate session at USAID to make sure that senior management of the agency understands the issues that you've been struggling with and some of the ideas that have emerged from this meeting. In the longer term, I think that there are, well beyond AID, there are possibilities for rationalizing the role of evidence, research, evaluation, and monitoring in the larger field of quality improvement. Now, before it becomes standard and universal in all the countries, this is the time to influence the design of those programs which are surely coming. They're already happening and expanding. One point that I felt deserved probably more attention than it received is what do we do with the knowledge that is generated by these quality improvement activities? And with hundreds of teams generating information, currently there is really no provision for capturing that knowledge in a standardized way and making it available to others in some kind of clearinghouse. A few references have been made to that. I think that deserves a lot more attention because we're at risk of wasting an enormous resource if we don't find a way to capture this knowledge and share it with people that will benefit from it when they're dealing with a similar issue. And this will certainly happen repeatedly. We don't need to reinvent the wheel every time there's some quality issue that arises when we have years and years of potential experience to draw on. I very much like the summary sessions. It's difficult to pick from those very concise and important general points that you made. But I do think that in the discussion from the program group, the point that we need to do better and when it comes to learning from our experiences is well taken. In that group, I think there was also a good deal of discussion about our ability to explain quality improvement to an audience that's not already an expert in that area. In the policy group, I think that first of all, you draw attention to the need for much more focus on policy issues and how they're approached, and to raise the issue of research in policy, I thought was an extremely innovative and interesting idea. The discussion of research itself, I think, is refreshing. It's refreshing to have people thinking about how to apply research to quality improvement. I think this is long overdue. I was especially happy to hear you mention the need to look at failures. We haven't been doing nearly enough of that, and that's an issue that's already been raised several times in this meeting. The need for prospective studies for building research into quality improvement is a very practical and welcome suggestion, which I hope we'll be able to act on in AID. The need for longer studies, I think, also implies the need for larger budgets, also something that I'd be very happy to support when I have the chance to do that. Thank you.
I just want to thank you, Jim, for your leadership over decades in USAID. I, for one, have learned a great deal from what you have sponsored over many, many years around the world. And I also want to acknowledge the fact that you asked for this workshop and follow-up events, and I think that's another demonstration of leadership. So thank you.